here's your host of the program, Dr. Louis Fetter.
Welcome once again to Here's Looking at You. You know us very well by now. We are the weekly show that discusses beauty and cosmetic surgery and dermatology and all of the things at home you want to know about, we try to tell you. And tonight I have two very interesting guests, very beautiful ladies who are friends of mine and are going to share some of their experiences with you. And allow me to introduce you to them right now. Kara Ostroff, good evening, and thank you.
Good evening.
And Victoria Pierce, who watches my money. She's one of my brokers and charges. I don't know what you're doing here. Who's watching the money? So let's get into some of the we're want to discuss before we're waiting. And Carol, tell me what you wanted to ask us.
Well, I'm very curious. I've been doing a lot of research on, of course, what to do to fight the aging look that happens to everybody. And I'm an aging showgirl and an actress and a producer, and I want to look good. And the thing that you advocate that I like so much is that you don't cut. You just lift and do wonderful things. So tell me about that.
Well, we do cut on some occasions. But sometimes cutting can be counterproductive. The aging process is not so much a loss of tone, but it's a loss of volume. And this has been shown very, very obviously now in many publications, both medical and in the lay press. It was just in the New York Times, that the loss of volume makes us look older. So if I merely cut you and pull you, unfortunately that may be counterproductive and you'll look skeletonized. You will not look natural. I'm sure you've all walked down the street up Madison Avenue or down Madison Avenue and you see many of the people in what's called the wind tunnel effect, where the face is just cut and pulled.
Oh, Lord. Yes, and it's so obvious.
So that's why I don't think in the vast majority of cases cutting and pulling, but rather now I do face fills and I put the threads in. I do a thread lift or aptos thread lift.
Now, where do you put those threads?
All right. Well, that's interesting because there are several kinds of threads out. I was the first doctor in the United States to use the Russian aptos threads. And what we do is the special, actually surgical suture that's been used in many other parts of the body, but they have special barbs in them. And sometimes I'll put them to the forehead after I Botox your face here to paralyze the muscles. Then 5 days later, I put the threads in, and I'll get the same elevation that other doctors are forced to do brow lifts, which are very expensive. You can lose sensation, and I'm going to get the same result because the subcutaneous scarring from those threads does the same thing. Then I'll put some of the threads here to build this part up and for the neck. I even do them now for the arms, and we're working on the buttocks.
Wow.
But there's another kind of suture lift also where we're basically just tying it up, running a loop here, coming here, and tying it up to support the face. And it's not the same as, say, a full facelift, but the results are pretty darn good, believe me.
Sounds good to me. Sounds amazing.
Yeah. So that's one of the things. But I want you to keep that in mind for other questions because everyone has been asking me, why don't you want to do cutting? But we do. But the trick today is face fills and elevation. That is the key to looking well and youthful and being happy. And the price is right. It's not expensive.
What do you use for a fill?
Well, the best thing is your own fat.
Oh.
I've done more than 3,000 face fills using the body's own tissue where I harvest it from the hip, I give it special treatment, and I call my procedure micro-lipo-foundation. I'm augmenting your face. Structurally, we're rebuilding the face, giving you back the tissue you lost. Now, we use Restylane, we've used, even medically pure silicone is allowed to be used in the face. There's a host of filler products, but there's 50 or 60 of them out. I only use 2 or 3. Fat is the best. Medically pure silicone, it doesn't travel, it's safe, it's approved for use, and we use hyaluronic acid. Restylane is just one brand name of hyaluronic acid. But those are the things I use. I don't use collagen much anymore because it's an antiquated product and I'm not happy with it in general. But there are many things that can be used best in the hands of the doctor. Now, you were asking us about the hair removal, right?
Yes. Can you tell me more about it?
Well, you know, patients today have found with the hair removal in years past, there's, shaving and there was tweezing, and we use the intense pulse light hair removal, and I think you sent some friends of yours to us. They're very happy.
They're very happy.
It's just, it's a light wave.
And you prefer it over the laser, correct?
I find it's better. I find the results a little more long-lasting. The price is is less expensive, and patients that I've treated seem to be very happy with the procedure. Like for the bikini line, men come in to have their back done. Women have sometimes in the mustache area. So it's a very nice thing just for maintenance and looking as well as you can.
What about photofacials? What
Well,
does that
we use the
involve?
same machine for that. The photofacials are wonderful because what they do is it's a light source that's stimulating the collagen. It takes away some of the red veins in the face. It's great for the pigmentary disorders in the skin. I myself do it about once a month, and I
What
love
about
it.
lines?
It helps to find lines. Now we're doing a thing now in the
But
office.
excuse me for
Yeah, sure.
interrupting, but while you're on that subject, you said you do it here on the hairline, maybe under the arms,
Yes.
bikini. How long does it take to get the redness? Is there redness?
There's no redness.
Oh,
I mean,
you mean it's instantaneous?
tell me about it. You know more
No.
about it than I do.
Yeah, there's no redness left.
No, because men have it, women have it. It's a very nice
So you
procedure.
just walk out of the
You walk
office and
out,
don't worry about
and
it?
there's no downtime,
No.
there's no redness, and there's no pain.
You can even be in
But
the
what
sun
about
if you
growing
want.
back? Oh, you can be in the sun. Well, you can't be in the sun very often with some of these other procedures, can you?
Exactly, you really can't. And I'm a big,
With a laser, you cannot.
in laser, in
It's a
general,
big
the laser, people tell you to be out of the sun for 6 months. I don't think laser is that effective in many cases because in many cases it's just too strong for the average face.
Oh.
There are so many nice, light, delicate things. I've had many lasers, and I've gone back to more, how shall we say, more used procedures because the results have been so nice.
Yeah.
I go back, for example, light chemical peels with the intense
Well, you did
pulse
that
light.
on me, and you
Yes.
did the pulse light to take away anything on my
Are you
hands.
pleased?
Very, very
Yeah.
pleased. My skin is getting to be just the way I like it, without these fine lines and without the redheads always have freckles, and I don't have very
No,
many
they're
on my
beautiful
hands.
like you too, is that
Oh,
right?
thank you.
You
What
have
do you
to.
recommend an IPL?
Well, I think IPL is good for any skin. That's what's so nice about it, because it reestablishes some of the collagen you've lost. It's great for pigmentation. It's a little stingy for a second, but in general, I combine the IPL with a light chemical peel and a microabrasion in one procedure. We charge very little for all three, and people are coming back all the time to have it every 2 or 3 weeks for the back of the hands, for the face, for the décolleté area, which is very commonly damaged in women. Women
Yeah,
go to the
I
beach
have-
and they lie there.
Call it the Louis
Yeah,
Vuitton
I stay
test.
out of the sun, but
Right.
still, sun gets on
The
there.
reason that stains so easily is because there's so little fat there. So when
Oh.
women go and sunbathe and lie down on the beach, it scars, and the pigmentation, and it makes the skin very thin and crepey. So I always tell the patients, please don't do that. Don't lie in the sun, especially in this area.
Right.
Protect the hands, and always wear a hat.
Right.
In addition to sunscreen and makeup.
Yeah.
People say, why would I want to? I wear sunscreen, it's enough. It's not enough. You need to wear a hat too.
But you do it in conjunction with the microdermabrasion.
Yes.
Well, what does that do?
Well, microdermabrasion, what it does is it's like sandblasting the skin in the controlled way.
Yeah.
It's like aluminum trisilicate particles, sand, and it just hits the skin ever so gently in a controlled way. Then we do a light chemical peel, and then we do the IPL. And we do that for the back of the hands, the chest, and the face. So that's one of the biggest things we're doing in the office now. People love it because it's very non-invasive, the price is right, and it really does a lot of good things for your skin.
How long does it last?
Well, it's permanent. Now, what we're doing is we're rejuvenating. It's like anything, maintenance. If I give you a brand new Rolls Royce, if you don't take care of it and wash it and take care of it, it's the same thing. Your skin is your biggest organ. Unfortunately, many of us didn't recognize what the sun would do to us, exposure. So these are things now people are coming to terms with, and there are so many things, topical agents, peelings, microabrasions, intense pulse light, which I think is a wonderful procedure. Far better, I think, than laser in general.
What age should you start all this? I mean, I'm at the age now where I need maintenance, maintenance, maintenance.
Again, I have a different concept. I don't believe age has any concept at all. You do things as you need them. Age is important if you're a wine or a cheese.
Have a pillow like that.
I've been using them for a long time.
Oh,
I
those
just adore
creams are
them, and they're
fabulous.
just,
But we
you
have
know,
new
really-
topical products, some of the things you've tried in the offices, I think you'll find very
fabulous.
effective.
There's the one that you rub for
Right.
bleaching.
We have the new bleaching product. We have the new Sega cream with the C,
Sega cream I
Yeah.
use, and it's just
That's a
fabulous.
great product because it's C, it's vitamin E, it's a glycolic acid, and a retinoid in a very unusual penetrating base. That cream is really magic. You use that cream every night, and I will guarantee you, within 2 weeks, you will see marked changes. The department stores can't sell you that
Oh,
because
that's
it's a
my
drug.
question. Yeah,
It's a drug.
yeah.
I'm giving you-
Nothing that they sell over the counter
can't.
can match it.
No. Now, even when I have mail order, I dilute the percentages to make it acceptable for people I've not seen. But for those of you who come to me in consultation, and I can
You're
see you.
stronger.
These things work.
Yeah.
These are drugs in cream form. These really work. In all due respect to Estee Lauder, she can't do that.
No, of course
Right,
not.
right.
True. But I've also been investigating liposuction. And you don't call it liposuction. You call it sculpture.
Yeah, it is. The word liposuction to me means I'm just sticking in a tube and sucking. That isn't what I do at
Yeah.
all. My work, I've done well over 3,000 liposculpture. I am dynamically sculpting the body. In fact, when I do it, I have a table that goes up and down intraoperatively, so I can see how gravity affects you. And I mark you before the surgery standing up to see how gravity affects you. And it's not how much I take out, it's how much I leave in. It's sculpture. And I do it by hand, by syringe. Dr. Pierre Fournier was my mentor in France, who was the godfather of cosmetic surgery, and I was his student. I worked next to him in Paris for more than 2 years. And he basically invented the syringe technique of liposculpture, and that's what I do. I do it by hand, by syringe, by sculpting. It does take me more time. It is more time consuming and more strenuous on the surgeon, but my results are superb.
Well, what about,
I'm
sorry.
Go ahead.
no, well, what about the skin? You take away the fat, but there's loose skin left over, isn't
That's
there?
a great question. So many people ask me that. The skin has an innate contractility, and surprisingly enough, when I come in with my cannula, it's making those skin cells, the elastic layers of that skin, reawaken.
Oh.
And then I redrape it with special French elastoplast, a tape that goes this way and that way, and I redrape the area. And lo and
No
behold,
matter what age, it'll go back?
well, obviously, the better tone you have, and the younger you are, middle-aged women come out beautifully. You get a better result. If you're an older patient with a lot of sun damage, very flaccid skin, obviously your result will not be as good as, shall I say, a woman like yourself, who's not a big sun person, who didn't damage yourself. So you're going to get a great result. So you come over here and I sculpt to, say, the saddlebag area, or in here. The results are excellent in 3 days.
And what about the arms, underarms?
I do that also. Now, for the arms, we come in the axilla with a tiny little stab wound and at the elbow area, and I sculpt out the whole area. Then I redrape it, and I'm getting wonderful results because women hate that. I've had patients
I hate that.
on a Monday operate, on Friday they're dancing strapless. They're so happy.
That's great.
Wow,
I
that's
mean, because I
fabulous.
work out and on my abs and on
Right.
everything, but
Right.
the skin.
This area especially, it is
Certain points
impervious
Can do.
Nothing.
Yeah.
to exercise. That is unfortunately a predetermined area.
Yeah.
This you're not going to work out. When I do ankle liposculpture, there's no exercise that's going to make you
Right.
lose the ankle, or around if the calf is too big. Through liposculpture, with tiny little openings, and the tumescent technique, which allows me to operate with no blood loss and no pain,
Yeah.
I get amazing results.
Is it a local anesthetic? Or?
Yes, it is. Many times, if I'm doing several areas, I'll have my anesthesiologist who's worked with me for more than 10 years. He's fabulous. He'll give you an intravenous. He'll ask you which island in the Hawaiian chain you choose to go to, and he will send you there.
I'm ready.
And then you'll wake up, and I can have you up within a minute. You recover in our recovery area for an hour, and you're on your way home.
Do you have to wear the girdle like they had to do in the olden
that's
days?
exactly right. What I do is we give you the special tape, and we give you a very nice girdle which you wear for 3 days.
Oh.
Then the tape comes off in
Very
3 or
nice,
4 days, and then you wear the girdle for another 4 or 5, and that's it.
Pretty
There's no
fast.
drains. There's no. Many times
Really?
I don't have to even suture you. I may use a little steri strip to bring it together.
Wow.
Really? And
So-
you can just go to work 2 days
Within
later?
a day or so afterwards, you're back to work. Absolutely. And the nice thing is, there's almost no pain because
No
the
pain.
solution we put in will serve as an anesthetic for 24 hours.
Really?
So there's no pain and there's no blood loss. But I'm going to come back to answer some more questions. I have some messages for you at home. Please don't go away. My staff and I are pleased to announce that we now have a Palomar pulse light system in our Fifth Avenue offices. For clear, beautiful skin, we have photofacial technology, which uses lasers and pulse light to remove skin imperfections. Pulse light can easily treat pigmented lesions, commonly called sunspots or age spots, and vascular lesions, including rosacea and spider veins. In addition, pulse light hair removal is highly effective, painless, and can be done in any area and is very quick and easy. The Palomar pulse light system uses a new technology that removes hair up to 10 times faster than ordinary lasers. Please call our offices at 212-535-8700 for an appointment to discuss this remarkable innovation or any cosmetic procedure or concern. Thank you. We are pleased to announce our new advanced triple facial therapy. This will include a photofacial, light chemical peel, and microdermabrasion, both for the face and the body. You can have an amazing cosmetic result at a very affordable price. Please call us. Thank you. We're back. Now, Victoria, you had a very pressing question during the break. Let's do it again.
Okay, I really want to know about light peels versus a deep peel. When do you suggest one or the other versus,
Versus
pulse
laser
light
or-
or laser, et cetera?
Yeah.
Well, light chemical peeling has been around for a long, long time. As a matter of fact, years past, back in the 1700s, women would use rotten fruit, old apples, rubbing it on their face,
Oh,
rotted
what a
apple.
great idea.
And that was actually glycolic acid peel. Because when the apple was fermenting, that's exactly what you were getting. You were getting
Yeah.
It's kind
glycolic
of
acid peel.
acidic or something?
Now, you come to the office and we do a light glycolic trichloroacetic acid peel on your skin. A few times, we can rejuvenate your face remarkably
But
well.
when you leave the office, are you like, I mean, you see people walk around with a big sunburn and they've gotten
Well,
one. And
perhaps that might not have been the right kind of a peel. Depends what you need.
Well, Dr. Feder didn't do
right,
it.
Well,
exactly.
That's right. But we see maintenance peels, the light chemical peels, we call our luncheon peels. They're not expensive. They rejuvenate your face, do your face and your hands with a light glycolic peel followed by a light trichloroacetic acid peel. Do that once or twice a month. You're going to look great. Do the back of the hands. Those are light peels. Then we have middle-level peels.
Does that actually slowly get rid of your lines, or is
Absolutely.
it just a maintenance thing?
It will. Now, sometimes the wrinkle that you're getting may not be just amenable to mere peeling. Sometimes you need to give you some filling also. So because many times the wrinkle is loss of tissue. So if I give you some face filling with peel, that's the...
What
So what
is
about a
a
deep
face-
one, though?
Now, deep peels are for people, for example, have really severe damage, sun damage, age. The main reason people look old, not just the aging process, it's the sun.
Of
Right.
course.
It's
Right.
both
Very
together.
aging.
You lie in the sun like a piece of
Yeah.
bacon.
Who knew?
Now we
A
know.
few years
But
ago.
the good thing is we can rejuvenate. We can bring you back and do so many things. Cosmetic medicine, which is what I do, has changed in such a degree that in the last 10 years, we have such wonderful breakthroughs that are non-invasive, that are cost-effective. This is not just for people who are very super rich. This is for everybody because the fees are affordable, things work. You can use topical products at home. You have to go to somebody who loves this work. I love this work. It's fun.
You have an anti-wrinkle cream, too.
do.
What's in that, and what's different
Well,
between that
it's a
and...
very nice thing. In fact, you're going to see me on one of the major shopping channels with it very soon. It's my Siga, which is vitamin C, E, the glycolic, and a retinoid in an amazingly effective...
All together in one
all
cream?
in one, in a very special penetrating vehicle, which really does amazing things. Now, I use that on my
But you
face.
have to keep that in the refrigerator?
No,
That
you
sounds-
don't.
Oh.
No, and I give you that after you use the special pad, which is like an acid peel in a jar. So just do 2 or 3 products. You can really have your skin up to its optimum. And anything else, like some face fills to fill the nasolabial frown line, make the lips a little fuller. Because you see, as we get older, we lose this tissue. Our lips get thinner, our nose gets longer, our ears get bigger. Things happen. But we can, but we can stop the clock. We can make that clock stop and make
Slow
it go
down.
back.
Good. All right, suppose I'm in the sun and I've
right.
done all of
All
this
right.
and my skin is now very sensitive. What should I wear on my skin? What do you suggest?
Okay, first thing you want to wear? A
What?
hat.
A hat.
A hat
Oh, okay.
is really great because a
But
hat
the
stops
SPF
everything.
50?
But in addition, I want you to use, I give you that waterproof sunscreen we have,
Yes.
and makeup,
Oh, okay.
and a long sleeve blouse, and
Yeah.
long sleeve pants, and you're not going to go to the beach anymore and lie out there and just sunbathe. If you're playing tennis, if you're swimming, by all means do so.
Yeah.
But just to lie there in the sun and bake,
It's
you don't want to
crazy.
do that. We know, because you're going to get skin cancer.
Yeah.
Not only do you look bad, you're going to develop keratoses,
Yeah.
squamous cell carcinoma.
Yeah.
Remember, I told patients many times before on the show, A, B, C, D, asymmetry, border, color, diameter. You see a change in any lesion, put the A, B, C, D rule to that lesion, bring it to your doctor, show it to your cosmetic surgeon, your dermatologist. Come to me. Go to somebody who knows what's going on, and we can prevent skin cancer by a wide margin if you pay attention.
All right, so we've had the glycolic peels and we've had
The
the
trichloro peel.
everything that you've recommended, but still we've aged and sagged and
Right.
you don't want to do a facelift, so
Well,
you're going to do
well,
what?
All right, I'll tell you. If it's really saggy, we may take some skin.
Oh.
But the truth of the matter is, like around the neck, in the vast majority of patients, I don't have to take skin. I do liposculpture with my special threads, and I can give you a beautiful new neckline.
And what about the fat, the filling?
All right, and the filling, at the same time, taking some of the tissue from here, I may take some tissue from here.
choose your own, right?
Exactly.
You don't take it from the saddlebags?
In women, that's the best place to take it.
Is it?
In men, I'll take it
So it's
normally from the abdomen.
liposuction.
Well, that's for harvest. One is liposculpture for sculpting the body, and if I'm taking it for the face, for example, I may just harvest from those areas, and then for the extra tissue I have, I take it and I freeze it. I have over 1,000 patients' frozen tissues.
Do you save it for later?
And I save it
How long?
for touch-up
How
later.
long?
It's good for 2 years.
2 years?
Sure.
Wow.
So you come back 3 or 4 months later for a touch-up, then 3 months again for a touch-up, and after 1 or 2 touch-ups, it's permanent.
Really?
That's what's so nice about it.
So forget collagen, forget all of that?
I wouldn't say forget it. I think using the Restylane and silicone has its place, but it's temporary. Silicone is more permanent. I want you to understand
But I
that.
understand that silicone floats.
Doesn't show, no. If it's done properly, and I've done about 1,500 patients with medically pure silicone. It's approved for use now in the face, so we can use it off-label. Silicone, if used properly, is very nice to fill. Now, I can't do volume with silicone by the nature of the product, but it's not going to shift, and if you have medically pure silicone, the results are quite nice. But fat is great, because it's your own,
It's
you
your
can't
own.
reject it, and you have an unlimited amount.
Yeah, true, I do.
So don't we
Where
all?
do you put it? You put it here in
Well,
the
that's an
cheeks? You
excellent
put
question.
it here?
In general, I'll come in here and I'll build up the eyebrow area.
Oh.
Then I'll come in here and I'm going to build up this sulcus in here. I hate this. This is called this little sad line. I fill this up.
But
I
about
lay,
the neck,
I lay
right
tissue.
here, everyone sort of gets a
Don't
little...
look at me when you
No,
say
me,
it.
I know.
You guys have a problem.
I do already, so...
Right. And then we'll come in here and I'll build up in here and the lips, and then I'll build up around the jaw.
You even put it in...
I do. I do hand rejuvenation
Yeah.
also. And the hand rejuvenation is great. We do a special chemical peel with IPL.
I know, like...
That's
I
right.
had it done, I don't want to say it.
Are you pleased with the results in your hands?
Yes, yes, I am.
You need
I'm
to touch
very-
up too, but you're going to see the hand, everyone needs it in the hand. Women must remember, stand on the beach, put your hands behind you.
Yes.
Don't put your hands in the sun. If you're working in your
I have a
garden,
boat.
wear gloves.
Yeah,
I
I
would
would love...
I'm Dr. Louis Feder, cosmetic plastic surgeon and dermatologist practicing for more than 20 years on New York's Fifth Avenue. I'm the first physician in the United States to perform non-invasive facial rejuvenation with Aptos threads and your own fat. There are absolutely no scars, and you can be back to work the next day. And it's affordable and almost painless. Call me if this or any other cosmetic procedure, including Botox, liposculpture, or our highly effective skin treatment products, interests you. See you soon. We are pleased to announce our new advanced triple facial therapy. This will include a photofacial, light chemical peel, and microdermabrasion, both for the face and the body. You can have an amazing cosmetic result at a very affordable price. Please call us. Thank you. Carol, we were talking about the concert today. We had a
Yeah.
little discussion just before the break.
Yeah.
Say it again.
Well, because sometimes you start too early, and then sometimes I think it's too late. Some men and women let themselves go so long, the wrinkles are so deep. I mean, I don't think there's anything that can be done. You shouldn't wait too long, but don't start too early. Don't you think so?
I think everyone ages differently. I mean, there's some people who are 70
Well,
who
that's
look just, you know, they've never done anything and they have no wrinkles, and there's some people at 40, they need something done already.
Well, what do you think?
I think it depends upon your lifestyle,
Yeah.
how you've been taking care of yourself,
But that's
nutrition.
genetic too, don't you think?
Genetics plays a role, obviously, but if it's a dynamic equilibrium between genetics and your lifestyle. And I don't think age has any effect. If you take care of yourself and
But I
you
mean,
do the right
30
thing,
is, or 35 to
there's
get
no-
your eyes
forget-
done is
take
ridiculous.
the numbers and throw them away. Nothing to do
Yeah,
with
but some
anything.
people might, I mean, they have, you know, droopy eyes or something, and that's sort of their own aesthetic that they might want it done, you know, at a
So
certain
it doesn't
age.
matter the number. It just matters how you want to take care of yourself and how you want to be. So
Yeah.
if you're careful, you're doing the right things. We all know about the sun exposure and the exercise
Yes.
and using the right products. Just slapping on some moisture,izer, that's not going to work. Everyone has to use treatment products today.
Oh, I
Things
want
that really,
everything.
You know, what do you
Maybe.
do about the ears?
It's in reference to getting bigger, you mean?
Yes.
Everything falls.
Well, you have very long hair.
Yeah, we can,
Oh, what a mess
We
we
can
could
cover
be.
it
Get a
up.
basket to carry yourself in.
No, but you see, there's so many things we all can do.
we don't want to be Dumbo walking around later on in life.
No, because you both look great, but you're doing all the right things. But you see, we started very carefully, the very non-invasive procedures. And you
Yes,
come in now and you see, just doing the IPL and the microbrasion and the light chemical peel and the things you're using at home. I think you're both pleased with it. I think both look great.
Oh, I love your products. I think they work, and I'm very pleased. And they're not
The products are fabulous, I have to say.
Yeah,
I mean,
they're not that expensive and they last.
I keep the products well priced, and I think just using them daily, the maintenance, and I think also nutrition.
It has to be like brushing your teeth. I mean, you have to just make it a habit.
Right. And
once in the morning, once at night.
Yeah.
Right. And now, like for example, right now, have you, in the last, 6 months, you've been using the products?
Every day, twice a day.
Have you noticed a change?
Fabulous.
What have your friends
people
said?
comment. People comment, actually.
Yeah.
Just glowing.
So if you get no sleep, don't blame me.
It's your fault.
And you're pleased you're using the products.
I'm
So,
pleased,
okay, so
yes.
it's the nutrition, it's the non-invasive procedures, and if you
No
have to,
sun.
if we have to do other things, we can do it. But non-invasive is the first thing you want to talk to your doctor about. First thing the doctor wants to do is do a facelift, shake his hand, and walk out of the office.
Yes.
But I want to thank you so much, both of you,
Oh,
for coming
pleasure.
on
Yeah,
tonight.
it's great.
The time just flew by. I do hope you come back. And I want to thank you at home, because we try, as you know, every week, very hard to bring you all this up-to-date information from glamorous, fabulous guests as we had tonight. And we hope to see you next week. We'll be here same time and the same station. Here's looking at you. Bye-bye. We are pleased to announce our new advanced triple facial therapy. This will include a photofacial, light chemical peel, and microdermabrasion, both for the face and the body. You can have an amazing cosmetic result at a very affordable price. Please call us. Thank you.
Dr. Feder invites you to experience the quality and effectiveness of his personally formulated skin treatment products and cosmetics. These acclaimed products have been dispensed and tested worldwide for over 15 years. The more than 100 products are free of any known allergens and contain only the finest quality ingredients. Once you've tried these products, you'll find them indispensable for maintaining a beautiful, clear complexion and general good health. For more information, call Dr. Feder, 212-535-8700. For information about any of the topics and procedures discussed on this program, we invite you to call Dr. Feder for an appointment or a free brochure illustrating the services and products available at his Fifth Avenue offices.